Earlier this year, a BBC investigation discovered that 9 in 10 NHS dental practices in the UK aren't accepting new adult patients. It's a shocking figure that means that getting dental treatment can be a real pain that can leave you in actual pain too. An estimated 10 million people are currently waiting for routine treatment, with some even resorting to DIY dentistry as they struggle to find care. Dental problems can not only affect our overall physical health, but can impact our self-confidence too. Well, one organisation is trying to help. DentAid is travelling the UK in mobile units to bring free dental services to vulnerable groups and to those struggling to get care. Today, the team is in Suffolk, where, according to the latest research, there are no practices taking on new NHS patients. Natalie Bradley is one of the volunteer dentists.
Lots of people we've spoken to spend a long time calling around trying to find an NHS dentist. They're in pain, it's really affecting their eating or sleeping. And so when they come to us, often they just need to get out of pain to be able to function, and that's what we sort them out with. What kinds of problems are they presenting with? Lots of broken teeth that have been broken or infected for a long time. Right. And so when we turn up, it's often a relief. Do you think you have a busy day on your hands? Definitely. We saw 38 people yesterday. Every single one was in pain. Everyone definitely needs to be seen. Outside, a queue started forming 2.5 hours ago. Andy, you're number one in the queue. What brings you here today?
I've got 4 teeth that are very painful. I'm hoping to get them pulled.
And you can't sign up to an NHS dentist, you've tried?
I've tried. Yeah, there is nowhere. Every NHS dentist is becoming a private dentist.
What issues do you have at the moment?
I had 2 fillings. I have a feeling one of them has come loose or something, so I've got aching all this side. If this wasn't here, I'd just probably leave it and it'd get worse, because it's such a faff getting to the actual dentist. So,
what will it mean to you to be seen today?
A lot, because it'll stop me feeling like someone's stabbing me in the face all day. Like, punch feels like someone's just going.
Also in the queue is Mandy Palmeter, who hasn't been able to see a dentist for more than 3 years. What's going on with your teeth?
Well, I've been told that I had an infection in my tooth, so I've had to have antibiotics, but I've got to have root canal or my tooth out.
How's that impacted your life?
Constantly on painkillers, and have to be careful to eat on that side, because when you eat on that side, it makes you jump.
Are you in pain right now?
Yeah, I am, yeah. And I'd really like the tooth to be taken out.
Mandy says her treatment was first postponed in the pandemic, but even after her practice was back up and running, staff shortages meant she couldn't get seen. Finally, her NHS dentist left the practice, and as she couldn't afford private treatment or find another NHS dentist, she hasn't been able to get the care she so desperately needs. Until now.
Are you all right in the chair like that?
Yeah, that's fine, thank you.
As Natalie gets to work on Mandy's troublesome tooth, I've come to meet the charity's CEO, Andy Evans.
So we started because we discovered that some homeless and vulnerable communities just really struggle to access the care. So we designed taking mobile units out to see them within their community, to really help them to get out of dental pain.
What types of communities do you service the most?
It's people experiencing homelessness, victims of domestic abuse, families in poverty, and cancer patients that are struggling to access care, as well as communities where they just struggle to access dentistry because it's quite restricted in that area. Yesterday we had a young lad that came in and he had a big swollen face, and
like an abscess?
An abscess that has got infected, and we were able to help him out. People don't realise that if you haven't been able to get to a dentist, it can blow up and it can cause serious side effects.
After half an hour in the chair, Mandy is finally ready to go home. Okay, you're smiling.
Yeah, I am, yeah.
How are you feeling?
Relieved.
Yeah? That took a while, didn't it?
Yeah, and they gave me the tooth.
Oh, that's lovely. Well done.
I wanted a souvenir.
Oh, you're amazing. What are you going to do with it?
Just
frame it.
Yeah, I just wanted a souvenir.
I mean, what do you think of a charity like this?
It's amazing. Really, really good. I'm really pleased.
Mandy might be smiling now, but it's clear that access to NHS dental care is a huge problem. British Dental Association chairman Eddie Crouch says the current NHS contract is largely to blame.
The profession have been waiting for a long time for a contract that actually makes it enjoyable or worthwhile to actually provide NHS care. We had a contract that was introduced in 2006, and here we are 16 years later, still waiting for a significant improvement. There can be nothing worse than suffering with toothache and not being able to actually get anyone to help you. As dentists, we want to do that, but we can't do that as a charity. And I think the benevolence of the profession has been tested to its limit.
Fortunately for these patients in Suffolk, the charity has helped ease their suffering. In just 6 hours, the team has seen 41 patients and performed 146 treatments. How do you feel after what you've done for these people today? There must be a huge sense of reward.
Yes, definitely. You know, having dentistry done isn't something that people like having done, but you know, the smiles of their faces when they leave and get off the van is just so totally worth it.
For anyone who feels they might have the beginnings of a dental issue, what sorts of things should we be looking for so it doesn't get as bad as some of the people were today?
So really important to, you know, monitor and check your own mouth and, you know, brush twice a day, good diet, avoiding sugar. If you are worried about anything, to try and get in with a dentist. And please don't be tempted to try and do the dentistry yourself. And I've been seeing some pretty nasty damage in the past from people trying to do this DIY dentistry. I know access is really difficult at the moment, but please don't take it on yourselves.
Accessing an NHS dentist can be, for some people, well, like pulling teeth. But at least the volunteers here today have managed to make a small chip in the number of people seeking dental care. Now, it is a small number compared to those in need, but for the patients who came here today and who were seen, it was incredibly welcome.